Hi everyone, welcome back to World Nursing Lecture Room. Today we are going to talk about a very important topic, mental health and nursing. So mental health affects how we think as nurses, how we think, how we feel, how we behave in daily life activity, and it is just as important as physical health. So for us nurses, understanding mental health is a key, both for our patients and for ourselves. So it is very important that we talk about mental health as for us nurses. Yeah. So what we are going to talk about is I'm going to look at what is mental health and mental health challenges, what mental health can cause, or what are the challenges in nursing related to mental health. And another thing that I'm going to talk about, the role of nursing or nurses in mental health. And the last one, or the last point, how nurses can take care of themselves to avoid getting into this situation. So you have to know that mental health refers to a personal emotion. This mental health refers to a person's emotional, psychological, and social well-being. So this influences how we handle stress, related factors, and making decision. So good mental health doesn't mean always being happy or always being sad. It means being able to cope with challenges and live in a balanced life. Let's talk about mental health challenges in nursing. As nurses, we face unique challenges that can affect our mental health. Long working hours, high patient load, emotional stress, sometimes lack of support, sometimes burnout, sometimes low paying or low salary, sometimes anxiety or and even depression. If you get a toxic environment as a nurse, you can fall into depression. Fatigue is also there. The emotional exhaustion from caring deeply for others and even if we forget about themselves, those are the things that are mostly affect nurses. So what are the roles of nurses in mental health? Nurses play a vital role in supporting patients with mental health conditions. I can say we provide holistic care that include not only physical treatment but also emotional support. We listen, we advocate. Sometimes we become first people to notice the patient is struggling with mental health, and even we forget that we also have mental health. And when you find a patient with mental health condition, or if you notice a patient is having the condition, you are the person to speak up for the patient. You are the person to care for the patient. You are the person to break that news to their relatives. So sometimes we end up forgetting ourselves. So let's see how nurses can take care of their own mental health, because sometimes we speak for others and we forget about ourselves. It is important for nurses to care for themselves, and these are the strategies. Practice, practice as a nurse. Make sure you practice stress management technique. Like you can take deep breath, you can do exercise, you can do journaling. Sometimes you find that um, you are dealing with rude relatives. You are dealing with rude relatives. They don't want to listen. They are questioning you, which is okay. They are as a if you are taking care of someone's patient, they have to question to maybe to just know what is going on. But some just ask even unnecessary question. So when you find yourself in that situation, take deep breath. You can do exercise when you go back at home, and you can also journal just to find a way of getting out of that situation. Also, you have to know that you are a human being. You must find a way of maintaining a healthy work life balance, whereby you find time for your family, you find time for yourself, you find time to go to the hospital, you find time to interact with others in just a normal way of life. Not every day, patient, hospital. You will get a lot of problem. If you find yourself in that situation whereby you find yourself depressed, you find yourself sad, you're having suicidal thoughts, you're having all those signs of depression, make sure you talk to your colleagues, you talk to your mentors, you talk to people who can help you. Seeking professional help when needed, because even caregivers need care. You can't treat yourself. If you're having, maybe let's say you're suffering from malaria, you will need someone to take care of you. So it is a very important that you find help. You can also find a way, or nurses, we can also find a way of reducing stigma and mental health by encouraging open conversation and creating supportive environment in workplaces. So whereby you get that mental health, it should always be part of total patient care. And as it is a part of total patient care, it should be also part of nurses in their daily life activity. They should be considered who they should consider themselves as in they can get mental breakdown, and in that situation they should be always getting a supportive environment just to around workplaces, yeah, in their workplaces, so that they can cope up with this situation. It is happening, so we cannot avoid it. We must talk about it. We must find a way how to deal with it. So what I want to say as I'm finishing this video, mental health is essential part of nursing, both our patients and ourselves. By caring for mental health, we improve quality of life, quality of care. So make sure that where you are working, where you are taking care of a patient, you are mentally okay. So guys, I'm going to stop from there. If you have any question, if you want to say something, write it in the comment section. Make sure you subscribe, like the video, share, comment. Don't forget to turn your notification bell so that every time I post a video, you will be the first person to be notified. Bye.